Imagine living in a world where, by the time you reach your 90s, you are able to keep the same level of strength and mobility that you had when you were younger. Doesn't it sound like it's too wonderful to be true? Every year, 1 in 4 persons over the age of 65 suffers a fall, which frequently results in severe injuries and the lost ability to function independently. These falls can be catastrophic, affecting not only physical health, but also emotional well-being. The fear of losing independence is a growing concern for seniors. But what if there was a way to dramatically reduce the chances of this happening? Imagine waking up every day knowing that you are not only protected from the risk of falls, but also empowered with the strength and mobility to carry out daily tasks without fear. This could be the new reality for you, regardless of age. The key lies in a simple yet powerful nutrient: vitamin D. Yes, this vitamin, often associated with bone health, is also crucial for maintaining muscle strength, stability, and overall mobility, especially in older adults. Vitamin D plays an important role in the absorption of calcium, which strengthens bones, but it also has a direct impact on muscle function. When vitamin D levels are optimal, your muscles work more efficiently, and your balance improves. This can dramatically reduce the risk of falls. It's not just about having strong bones, it's about having strong, flexible muscles that allow you to move freely without hesitation. Vitamin D ensures that your body's muscle strength is maintained and can even improve with proper supplementation. Research has shown that seniors with adequate levels of vitamin D have a 23% lower risk of falls. This nutrient plays a critical role in muscle recovery and function, making it a key player in maintaining a high quality of life for older adults. So, how can you ensure you're getting enough of this powerful vitamin? By spending time in the sun, incorporating vitamin D-rich foods into your diet, or supplementing with vitamin D, you can significantly boost your levels and protect your mobility. Let's take a closer look at how to increase your vitamin D levels and the positive impact it can have on your life. Whether it's through diet, supplements, or sun exposure, this small adjustment can yield significant benefits in your overall health and well-being. What happens when we don't get enough vitamin D? Many seniors don't realize how low their vitamin D levels are, and the consequences can be severe. Vitamin D deficiency is more common than most people think, especially in older adults, and can lead to several health issues, such as weakened muscles, poor balance, and an increased risk of falls. A lack of vitamin D can cause a cascade of negative effects in the body. When vitamin D is insufficient, it becomes harder for the body to absorb calcium, leading to weaker bones and joints. This directly impacts your ability to move safely and confidently. If you have trouble standing up from a seated position, experience frequent leg cramps, or feel unsteady on your feet, these could be signs of vitamin D deficiency. Often seniors overlook these early warning signs, attributing them to normal aging, when in fact they may be a signal from your body telling you to get more vitamin D. In fact, research has shown that people with low vitamin D levels are twice as likely to experience a fall compared to those with normal levels. This means that just by ensuring adequate vitamin D intake, seniors can significantly reduce their fall risk and improve their overall mobility. So, how do we solve this problem? First, we need to be aware of the signs and symptoms of deficiency and take action to address it. Vitamin D deficiency is easily diagnosed with a simple blood test, which is the first step in determining if you need to make changes to your diet or supplement routine. If you suspect you may be deficient in vitamin D, it's crucial to consult your doctor, who can help you create a plan to restore healthy vitamin D levels. Whether through sunlight, food, or supplements, the right combination can make all the difference. Once your levels are restored, you'll begin to notice improvements in your muscle strength, balance, and overall mobility. This will lead to fewer falls, increased independence, and an overall sense of well-being. It's not just about preventing falls, it's about giving you the confidence to live your life to the fullest, no matter your age. Now, let's dive into the best ways to ensure you're getting enough vitamin D. It starts with small, consistent changes to your daily habits, whether it's eating foods rich in vitamin D, getting sunlight exposure, or taking supplements. These steps will add up over time and help you maintain your strength and independence as you age. Why is vitamin D so important for seniors? As we age, our body's ability to produce vitamin D naturally decreases. This is due to several factors, including reduced skin thickness, which impacts how much sunlight our body can absorb. Vitamin D plays a critical role in maintaining both bone health and muscle function, which is why it's especially important for seniors to be proactive in ensuring they get enough. Beyond bone health, vitamin D is essential for maintaining strong muscles. Without it, muscles weaken, leading to difficulty with movement and an increased risk of falls. The impact of this vitamin extends far beyond just bone density. It supports the muscles that help us stand, walk, and carry out everyday activities. One of the most common signs of vitamin D deficiency is frequent muscle cramps. If you find that your legs are cramping or that you are experiencing more aches and pains than usual, it could be a sign that your vitamin D levels are low. Addressing this deficiency could make a dramatic difference in how you feel day to day. In addition to muscle cramps, low levels of vitamin D can cause bone pain. This is especially problematic for seniors, as bone density naturally decreases with age. Without sufficient vitamin D, bones can become brittle, increasing the risk of fractures. Regular intake of this vital nutrient can help keep bones strong and resilient, reducing the likelihood of breaks or fractures in the event of a fall. Studies have shown that seniors who take vitamin D supplements regularly experience fewer falls, stronger bones, and improved mobility. In fact, vitamin D has been linked to a significant reduction in the risk of hip fractures, a common injury among older adults. By addressing vitamin D deficiency, seniors can enjoy greater stability and confidence. Vitamin D also plays a crucial role in immune function. As we age, our immune system weakens, making us more susceptible to illnesses. Vitamin D supports the immune system by enhancing the pathogen-fighting effects of monocytes and macrophages, which are critical in defending the body against infections. For seniors, the benefits of maintaining healthy vitamin D levels go far beyond preventing falls. Vitamin D is essential for promoting cognitive function and mental clarity. Some studies have even linked low vitamin D levels with an increased risk of cognitive decline and dementia. Keeping vitamin D levels within the recommended range is one of the many ways to support both physical and mental health. Now that we understand why vitamin D is so crucial for seniors, let's explore some effective ways to increase vitamin D levels. Whether it's through food, sunlight, or supplements, there are several approaches that can help ensure you're getting enough of this vital nutrient to maintain your strength, health, and well-being. How much vitamin D do you need? The amount of vitamin D you need varies depending on your age, health conditions, and lifestyle. For seniors, the recommended daily intake is higher than for younger adults. The general recommendation for adults over 70 years old is 800 to 1,000 IU, international units per day. However, some individuals may require higher doses depending on their health status and vitamin D levels. Many people think that they can get enough vitamin D through their diet alone, but it can be difficult to meet your daily needs without supplementation. While some foods contain vitamin D, such as fatty fish, fortified dairy products, and egg yolks, the amount found in these foods may not be sufficient for seniors, especially those who have limited sun exposure. Vitamin D supplements are an effective and convenient way to ensure you're getting enough of this crucial nutrient. Supplements come in two main forms: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. While both forms are effective, research suggests that vitamin D3 is more potent and better absorbed by the body. When taking vitamin D supplements, it's important to take them with a meal that contains fat. Since vitamin D is a fat-soluble vitamin, it is better absorbed when consumed with foods like avocado, nuts, or oily fish. Taking your supplement with the right foods will maximize its absorption and effectiveness. It's also important to monitor your vitamin D levels regularly, especially if you're taking supplements. A simple blood test can determine whether your levels are within the optimal range. Your healthcare provider can then adjust your dosage if needed. Too much vitamin D can lead to toxicity, causing symptoms such as nausea, weakness, and kidney problems, so it's important to stay within the recommended limits. While getting enough vitamin D is essential, it's just one part of a healthy lifestyle. Regular physical activity, a balanced diet, and maintaining a healthy weight are all important factors in maintaining strong bones and muscles. Additionally, avoiding smoking and excessive alcohol consumption can help keep your bones and muscles in good condition. For seniors who are housebound or have limited access to sunlight, taking vitamin D supplements is even more crucial. With less exposure to the sun, the body's ability to produce vitamin D naturally decreases. In these cases, supplements are an important way to ensure that vitamin D levels remain optimal. To summarize, maintaining optimal levels of vitamin D is crucial for seniors to keep their bones strong, muscles functional, and overall mobility intact. By incorporating vitamin D-rich foods, getting some sunlight, and taking supplements if necessary, seniors can reduce their risk of falls and fractures and maintain a high quality of life. The best sources of vitamin D. While supplements are an excellent option for those who need extra vitamin D, getting this nutrient from food and sunlight is always the best approach. Let's take a closer look at the top natural sources of vitamin D that you can include in your diet. Fatty fish, such as salmon, mackerel, and sardines, are some of the best natural sources of vitamin D. A 3.5-ounce serving of cooked salmon, for example, contains over 570 IU of vitamin D, which is more than half of the recommended daily intake for seniors. These fish also provide heart-healthy omega-3 fatty acids, making them a great choice for overall health. Another great source of vitamin D is egg yolks. While egg whites are rich in protein, egg yolks contain vitamin D, with one large yolk providing about 40 IU of vitamin D. Including eggs in your daily meals is a simple way to boost your vitamin D intake, along with other essential nutrients. Fortified foods are also an excellent option for increasing vitamin D intake. Many dairy products, including milk, yogurt, and cheese, are fortified with vitamin D. In fact, a cup of fortified milk can provide up to 100 IU of vitamin D, making it a convenient option to include in your diet. Mushrooms are the only plant-based source of vitamin D. When exposed to sunlight or ultraviolet UV light, mushrooms produce vitamin D, making them a great choice for vegetarians, or anyone looking to increase their intake of this nutrient without consuming animal products. Certain varieties, such as maitake and shiitake mushrooms, are particularly high in vitamin D. Sunlight is a powerful, natural source of vitamin D. When your skin is exposed to sunlight, it produces vitamin D. Ideally, you should aim for at least 15-30 minutes of sun exposure on your face, arms, and legs several times a week. However, it's important to balance sun exposure with the risk of skin damage, so always protect your skin with sunscreen if you plan to stay outside for extended periods. It's important to note that the amount of vitamin D your body produces from sunlight depends on various factors, including where you live, the time of year, and your skin tone. People who live in northern latitudes or have darker skin may need longer sun exposure to produce sufficient amounts of vitamin D. For those who may struggle to get enough vitamin D from food and sunlight alone, supplements are an excellent option. Vitamin D3 supplements are particularly effective and can help fill the gap if your body isn't producing enough vitamin D naturally. Talk to your healthcare provider to determine the right dosage for your needs. By incorporating these vitamin D-rich foods and practices into your daily routine, you can significantly improve your health and reduce the risk of falls, fractures, and muscle weakness. Vitamin D is essential for maintaining strong bones, muscles, and overall mobility as you age, and making small adjustments can lead to lasting benefits. How vitamin D works in the body. Vitamin D is often referred to as the sunshine vitamin because it is produced in the skin in response to sunlight. But its role in the body goes far beyond just supporting bone health. It is essential for a variety of bodily functions, including muscle strength, immune health, and even mood regulation. Once absorbed, vitamin D travels through the bloodstream to various tissues and organs in the body. It helps regulate calcium and phosphorus levels, which are critical for bone health and muscle function. Without enough vitamin D, the body can't effectively use calcium, leading to weakened bones and muscles. Vitamin D also plays an important role in regulating immune system function. It enhances the pathogen-fighting effects of white blood cells, which help protect the body from infections and chronic diseases. Maintaining optimal vitamin D levels can support your immune system and help you stay healthy as you age. One of the lesser-known benefits of vitamin D is its positive effect on mood and mental health. Research suggests that low levels of vitamin D may be linked to conditions such as depression, anxiety, and seasonal affective disorder, SAD. Getting enough vitamin D can help boost mood, improve mental clarity, and reduce feelings of sadness or fatigue. Another important role of vitamin D is its involvement in the prevention of certain chronic diseases. Studies have shown that adequate vitamin D levels are associated with a lower risk of cardiovascular diseases, diabetes, and certain types of cancer. This makes vitamin D not only essential for bone and muscle health, but also for overall disease prevention. Many seniors don't realize the impact that vitamin D can have on their overall well-being. Low vitamin D levels are often overlooked, but they can contribute to a variety of health issues. That's why it's important to make vitamin D a priority in your daily health routine. The good news is that getting enough vitamin D is easier than it seems. By making small changes to your daily routine, such as spending more time outside in the sunlight, eating foods rich in vitamin D, and taking supplements if necessary, you can ensure that your vitamin D levels stay within the optimal range. Maintaining a healthy lifestyle goes hand in hand with ensuring you get enough vitamin D. Regular physical activity, a balanced diet, and adequate sleep all contribute to your overall health and well-being. When combined with vitamin D, these habits can help you live an active, independent life for many years to come. Conclusion: the importance of maintaining vitamin D levels. As we've discussed, vitamin D plays a vital role in maintaining strong bones, muscles, and overall health. For seniors, ensuring that vitamin D levels remain adequate can help prevent falls, reduce the risk of fractures, and improve mobility and strength. The benefits of vitamin D go beyond just bone health. By supporting muscle function, enhancing immune function, and even improving mood, vitamin D is an essential nutrient that supports various aspects of well-being. Whether you get your vitamin D from sunlight, food, or supplements, it's crucial to prioritize this nutrient in your daily routine. It's important to remember that while vitamin D is crucial for overall health, it is just one piece of the puzzle. A well-rounded approach to health includes regular physical activity, a nutritious diet, staying hydrated, and maintaining mental health. Combining these healthy habits with adequate vitamin D intake can lead to a longer, healthier, and more independent life. If you are unsure about your vitamin D levels, don't hesitate to get a blood test to check. Consulting with your healthcare provider about your needs and the appropriate dosage of supplements is a great first step towards improving your health and maintaining your strength. The path to maintaining your health and independence as you age starts with small, consistent steps. Don't wait until you experience muscle weakness, bone pain, or other signs of deficiency. Take action now by incorporating vitamin D-rich foods into your diet, getting sunlight, and considering supplements if necessary. By ensuring your vitamin D levels are in check, you can continue to enjoy life to its fullest, free from the limitations that come with muscle weakness, poor balance, and frequent falls. Keep your independence, maintain your strength, and live a life that's vibrant and full of energy. Take control of your health today. Keep your vitamin D levels optimal, and the benefits will last for many years to come. Your future self will thank you for taking the time now to invest in your health and well-being.